Thank you guys for joining us. I don't know what time it is your time, but it is 7:01 our time. So we are ready to go. We're so lucky to have Marial here with us today. And, you know, I am one voice in the pediatric music therapy community, and Marial is a wonderful voice that we have. So she completed her master's in music therapy at Colorado State in Fort Collins, Colorado. Kicks butt at Texas Children's Hospital in Houston, Texas, and possesses a passion for serving TBI and ABI and rehab units. She is a Neurologic Music Therapy Fellow, and we are just lucky to be able to chat with her a little bit today. So if you guys have questions, feel free to throw them in the comments, and we will get to those. Thanks for being here. I'm so excited.
You're welcome, Amy. It's an honor. Thank you for inviting me. Been
all right.
Out all day.
So after a long day at work, I'm going to ask you some more questions.
That's okay. These are questions about things I love. Not like, where are the elevators to Legacy Tower? So
I feel like that happens to me all the time, and it's always somewhere I don't know where it is. Like, I've been working on my site for 7 years, and I'm like, where is things?
You look kind and approachable. Do you know where the da-da-da-da-da-da-da is? And I'm like, no.
No, I should say that.
I'm kind and approachable. I'll find you someone who does.
Exactly. That's my answer to most things. I'm not sure, but we will find who does. Awesome. Well, what year did you graduate your undergrad?
Ooh. I graduated in 2013. No,
okay.
Undergrad. Oh, even older, y'all. 2011. Taking it back 2 years.
Nice. I knew we were close. I was 2012. So yeah, we've been in the field similar amounts of time, and we just got to know each other, I think, through conference.
Surely. I mean, you are a powerhouse. I remember vividly sitting next to you because I was connecting through Tennessee. We were in, maybe our planes were close, at the Kansas City conference.
Oh
and
my gosh.
Talking with you at the gate. And I was like, oh my gosh.
That's right. Yes. So yeah, we've connected through conferences and like networking tables. And now we get to co-chair the pediatric work group together. And I am so lucky to have you powerhousing that. So if you guys haven't seen, check out the Facebook page, AMTA Peds WG, and we have all kinds of fun stuff for you guys there as well. So we are going to just jump into it. I'm so excited to ask you these questions. So the first is, why did you decide to pursue medical music therapy?
His name is Ben. I was in high school and heavily involved in choir, and my voice teacher's son, Benjamin, was a beautiful soul. He absolutely loved coming into my sessions and saying hello to me, and he has severe autism spectrum disorder. And so getting to then stay after my voice lessons and see him work with a music therapist in his home was pretty mind-blowing for someone as young as I was. I mean, my voice teacher had 2 degrees in music. So for someone else to be able to come in and utilize music as a tool that was going to enhance not only Ben's life, but the whole family's life, was really cool to bear witness to. And so I went to LSU and got an undergraduate in music education with an emphasis in special needs, thinking I would be a music teacher. And on my path there, found out about music therapy. And my brother got recruited by Colorado State University to play for their offensive line. So I auditioned and ended up becoming a Ram, just by good fate. Big, like happy bear-like guys, Ben and Jared. I'm grateful for them both.
That's so cool. I didn't know you went to LSU.
Yeah, go Tigers.
Yes, my boss is a huge LSU fan, and like his whole office is LSU everything.
I'm sure he is currently as sad as I am about how our season's going.
Yeah.
May not be able to tell it, but in my heart, tiny fractures.
Yes. That's so cool. So who are your biggest supporters that got you to where you are at Texas Children's?
Oh, well, no longer at Texas Children's. I must bow and say thank you to Amy Smith, who was my predecessor there, and the reason that I ended up being recruited to Texas Children's. I think that you can't go back and say thank you to the people in your past without saying thank you to the people in your present. So thank you guys for tuning in, for watching us and learning about music therapy and how cool it is. I'm super grateful for my colleagues in the work group and across the profession. I'm really grateful, of course, to my husband. I feel like he could probably answer, Amy, every single one of your questions. He knows so much about music therapy. And then, of course, my family. They have, since the very beginning, me singing uncontrollably at times, and believing in this passion, even when they didn't know what music therapy was. Specifically, my dad, he taught me work ethic and integrity. Mm-hmm. And my mom taught me to choose the positive side. Don't just look there. And my brother tolerated 2 years of Satan's instrument of sorrow. He coined it, AKA the auto harp.
Ooh.
That's as you can tell, I'm a phenomenal auto harp player. Jared would be the first to let everybody know.
That's amazing. Did you learn that at Colorado State?
Yeah, it's a mandated part of the curricula. At least it was 8 to 9
back in the day.
Yeah. I don't know if they're currently teaching it anymore. One can only hope not, but
yeah. That's so funny too, thinking about different programs and the things that we mandate for some and not others. And
that's right. Can't wait to get unified.
I think it would be great, right? And it's interesting, like I felt like as an undergrad, I had no idea what I was looking for in a music therapy program. But you see so much of like who people are based on the people they learned under.
Surely. I'm, Googling music therapy programs and come across Florida State, NYU, and Colorado State. That's where I ended up auditioning. And they are such vastly different programs with different kind of tracks or lanes that they educate through. So who knows if I would have even ended up in peds if I had gone elsewhere. I'm lucky, I guess. I'm happy.
Yeah, that's so
Colorado State ended up being a really good fit.
Yeah, I totally agree. So speaking of students, I've been thinking about this a lot. I take on interns, you have interns. And if you could give your student self any piece of advice, what do you think that advice would be?
I think that if my interns take away anything from their internship, it is that authenticity is the most important trait, lesson, value that you can have. Being 100% your authentic self and mutually respecting and seeing others 100% authentic self. I think there's a place for all of us to be who we are in this world. And I think if people realized that, our world would be a better place. So authenticity, be who you are, respect others for who they are.
Yes. And I think that's so hard as a student, right? Like I had no idea who I was like at all. And as a student, I was and like so focused on what I was doing and like if I was messing up a chord or if I was like saying the perfect thing. It's so easy to get like wrapped up in your head. But kids, especially in the hospital, they'll tell you what
they know.
They know.
They know when you are, I think it's because, not to like speak poorly of who we work alongside of, but a lot of times there might be a wall with other medical professionals just to keep them keeping on. And they can tell when someone is not being authentic with them or is only sharing half of themselves or the story. Yeah. And so, especially working in peds, it's a lesson that you learn quick because they'll call you out.
Mm-hmm. Yeah. I was in a session a day or two ago and she was like, It's really awkward and quiet in here. It's like, oh, okay, cool. Well, let's like talk about something. So yeah, and we want people to be authentic with us, right? Like we talk about that in our goals and how people have to be vulnerable with us. I don't know why we wouldn't expect that from ourselves. So I love that. Yeah, cool. So I was joking with an intern the other day and saying, I think my first full year of being a student, a professional, still felt like a student. I cried like all the time. I just had like, it was a rough transition for me. Like I was starting a program. I was by myself.
That's so true.
And so many of us are by ourselves. So what was the hardest part of your first year, like moving from intern to medical music therapist? And you were by yourself too, right?
No, so that's what I was going to say. My experience is going to seem like a cakewalk in comparison.
No, they're all relative.
I literally was just poor and cold. I had moved I had kind of grown up, in a subtropical climate for most of my life, minus those few years in Colorado. And my first job was at Riley Hospital for Children in Indianapolis. And it was cold there. And it's a philanthropically funded program. So initially, accepted a job and we were just paid way under our value. We got a new manager that year and she was able to do a cost market analysis of all of the positions within our department. And lo and behold, we were all due a big pay increase.
Yes.
So I turned up the heat in my tiny apartment and thrived. No, definitely. I'm so lucky because I came into a team of incredibly seasoned professionals. Ann Hannon, Lauren Servos, amazing music therapists and mentors still today that were very patient with me. I can be a little bit gung-ho, a little bit, that's a lie. I can be a bit gung-ho. I'm definitely a doer and not always a thinker. And they were so patient in helping shape and mold me, and also their willingness to grow and learn alongside of me.
Mm-hmm. That's so nice.
It was so nice. I love Riley Hospital for Children, Indianapolis, my colleagues and coworkers there. It was a really great start.
That's
so cool. Rough spot, being cold and literally not being able to afford more than my rent for a few months. It was terrifying.
And that's such a great point. And I'm so glad that you had professionals there who were looking at those things and thinking about, I had no idea as a baby music therapist that like I could argue for a livable wage, or that like it's okay to look at like cost market analysis and see what I should be getting paid, to ask for raises. Like as women in healthcare too, I think that that's such an important thing. You deserved heat. Like we all deserve heat and food and
heat. Those are the things that like I really need to thrive.
Heat and food. So that's awesome. I love that.
Yeah.
I also had a supervisor who was like really into that and was able to really advocate for us before I knew what I was
nice.
for. Yeah.
At least like you may not have someone who knows exactly what you do, but is willing to go to bat for you. That is nice.
Yes.
I've been in situations since then where it's not the case. So it ebbs and flows.
Yes. And like having, like you said, somebody, it doesn't have to be a music therapist who's your mentor when you're new. There's so many people who, even though it's a little different, they can still provide good mentorship in the hospital. I've learned some of my best lessons from nurses and physicians, like people outside of music therapy.
Right.
So I love that for you. I love that you had all those fun friends. With all of that, I think another thing that surprised me, I was very lucky. I had an awesome internship at Nationwide Children's in Columbus.
Wow, yeah.
And I didn't realize, like, when you're in school, like, you plan your sessions and, like, get everything ready for when you're there. But, like, there are so many things that are encompassed in our work that are outside of Is there one thing that you never, or were like surprised or never considered would be part of like your daily workflow or weekly workflow?
I mean, absolutely. Way more than one thing, probably 100
Yes.
things, but let me not scare everyone. I think the top of my list is diapers. What? Changing diapers? Ah! For my colleagues out there who are adult medical music therapists, I tip my hat to you if that's something that you do. I think it might be specifically a peds conundrum, but yeah, being part of like comfort care, like helping the nurse grab alcohol swabs or learning how to suction, like things that I was like, oh my gosh, like, whoa, medicine. Ah, I know how to sing. I think I know how to make people feel good. But like, this is definitely things that they just don't teach you about.
No.
And how could they know? I think it's that. Yeah, I think it's, I never thought like, oh, I'm going to need to climb a ladder and hang these streamers from the ceiling because we're getting ready to have a Halloween party. Like the little things about like normalizing the hospital and really making it family and kiddo centered that extend far beyond music.
Yes.
Are important as well.
You bring up such a good point with like suctioning and medical devices. I knew nothing of medical devices until I got there, and everything scared me because like there are tubes, there are beeps, like I don't know what's happening. I think I like almost pulled out an NG tube one time when I was still a student, like because like you don't know, you're trying to pick them up, but then that's falling off, and like
you're like, oh, is that your tray
attached to you? Yeah.
Again, great. Where were we?
Yes. And knowing what like a true emergency is versus something like you said, like you can pop something back on or it's just a beep because the machine is being funny or something. So yeah, I totally feel you. If you were a patient, I love this question, undergoing a long-term hospitalization, how do you think you would handle the experience?
Poorly. I think because we are medical music therapists, we've seen the wizard. We know who's behind the curtain, and it's a man or a woman who also went to school and then prescribes medicine that may or may not work. We know the conversations that happen in the hallway outside of the room versus what they tell you in the room. So I think that I might struggle. Would definitely be we call them high needs patient. I would be a high needs patient. I'd be like, hi, I don't go away, resident. Go. Yeah. Can I to the attending? Can you bring them in here? Who are the decisions? And also, I think depending on like the severity of my illness, I would probably choose art therapy over music therapy. I just don't know if I could like let go of, or like, well, why did you bring this?
I understand your like goals here. Like, why are we doing it? Right. Yeah.
I think I would start with art therapy. And if I got like sicker, then, if I'm intubated and sedated, then you bring me someone that can sing Celine Dion and mean it.
Yeah. I will be that person. I will come sing Celine Dion. That's such a good point with like, all those conversations. I think that would be the hardest part for me. Like knowing that there's like inside room conversations and outside room conversations sometimes.
Absolutely.
Yeah.
And then like outside, like not even in the hallway, like in the elevator on the way down where it's like, whew, that lady wants the sun and the moon. How are we going to get an art therapist here?
That's so cool. Do you work with art therapy?
Yes. Yeah. We're so lucky to have 2 amazing art therapists on staff at Texas Children's, which we're hoping to continue to grow. So
that's amazing. I love that. So I get this, I asked this question to my prospective interns, and I think it's a good thing to think about. But I want to hear from a medical music therapist standpoint. What do you think are 3 qualities that are necessary for someone who wants to be a medical music therapist?
Absolutely. The first, maybe the most important, I think they're all equally important actually. Like if you had like a tripod and you were to take one away, then like they would fall. Yeah, yes. So the first is flexibility. It is knowing that what you learned in school and what you learned through your internship is going to equip you to adapt in every moment, which is every moment that's needed. The medical setting is not predictable. Kids get better, kids get sicker. All of a sudden there's a rehab therapist that wants to co-treat instead of the session that you were going to have. You need to incorporate siblings this time around. Mm-hmm. There is just literally no 2 days that are alike. There are no 2 days alike. I mean, we've been doing this for almost a decade, 365 days a year. Mm-hmm. Well, sometimes I get Saturday and Sunday. I'm kidding, all the time. But I literally couldn't tell you like, oh yeah, oh my gosh, this is weird. This is a mirror image of the day I just had.
Yes. Or that like it's the day you plan to have when you start the day. Like I don't think I've ever had one actually like go the way I thought it would go or like plan for it to go.
Yeah, no. So flexibility / adaptability.
Yes.
The second is inner strength. Mm-hmm. So we are lucky that we are getting to work alongside of the smartest, most credentialed people on the planet. Literally, they are making like medical history every day alongside of us. And I think it could be easy to be intimidated or to step aside of medical greatness, but we must remember that we are medical greatness. We need to know our value and worth. We need to be willing to stand alongside these individuals and sometimes stand up to them and advocate for what is right and for who we are. We are valued in this setting just like they are. And so knowing your worth, self-strength is going to be incredibly important in a medical setting.
Yeah.
3, right?
Yes.
Oh, the flip side of that coin is that you have to be, stay humble. You have to be able to laugh. Right. You have to be able to know you're going to make mistakes. Things are ever evolving. Mm-hmm. I mean, could you imagine if the doctors we worked alongside of stopped learning or creating new interventions and new medications? We just wouldn't progress. So we must be able to do that as well. And that takes humility. It takes the ability to say, I'm sorry, I made a mistake. I learned from it. It will be different and better next time. Mm-hmm. And then to be able to laugh at things. I don't know what it's like humility.
A sense of humor.
Yeah, a sense of humor and a humbleness about you while knowing who you are, having strength in that, and then being willing to go with the flow, stay flexible.
Yeah, I love that. I think the inner strength one is something that I did not feel prepared for, and I'm still learning and working on. I think that's such a good one.
I guess my number one was flexibility because I think that was, I can be a perfectionist. I want things to always be the best versions of themselves. And what I've had to learn is like, sometimes the plan doesn't go the way you planned it, but it goes the way it needed to go.
Yes. I'm going to write that on my wall. Marial Biard.
Sometimes things don't go the way you planned them.
Yes. That's so cool. I love all that. I'm really going to write some of that down. See, I'm learning too. We always learn. Everyone.
Yeah.
So speaking of flexibility, I've had multiple sessions today not go the way I planned them. And most days. But tell me a session that didn't go like you planned it and what you learned from that.
Yeah, literally. This was one of those like questions where I'm like, oh, so every session or, it is nice. It is nice to have an idea of what you're wanting to accomplish. We are goal-driven, goal-directed modality after all. So it's nice to go in with some sense of like, I know what I'm going to target here, and I think I know how I'm going to do it. What interventions I'll use, what music instruments and songs are needed for those interventions. But yeah, then typically things go to pot. I could rack my brain and try and find a session but today is probably my strongest example.
It's always today, isn't it?
It is, right? Yeah, because it's every day. So we're reinitiating Wiggly Wednesday or Tiny Tunes on our cancer.
Love Wiggly Wednesday.
Yeah. So it's a group for typically are like 3 to 4-ish and under, because they're not getting opportunity for social interaction and development like most toddlers, waddlers, preschoolers would be. And we have a lot of different modalities in the hospital that target our school age and up. So it's COVID times, which means a group these days is a group of 2.
Yes.
But we're planning, we're having, it's been on my calendar for quite some time. We're gonna have 2-year-old patients, both with the comorbid diagnoses of Down syndrome and cancer. And we are gonna see what it's like when we get them together, and to work on some developmental skills, some social interaction, and honestly to enhance both caregivers who were going through some stuff, to enhance their day as well. So we set up blankets, we get things ready, both of them walk into the playroom, we start up our hello song, there are little shakers, and one of them is just like clicking, smiling, he's making increased eye contact, he's starting to verbalize, it's amazing. And the other one has like a full-blown meltdown, like climbing up mom like a tree, like hold me, I can't get in here, crying, just like sensory overload.
Yes.
So we ended up having a group of 1 with 3 working professionals from the hospital and a mom.
Yeah.
And man, did baby love to be the center of attention. Totally soaked it up, had a blast. So it didn't go how I wanted it to go, but it went how they needed it to go. I think for both of them. Don't worry, we'll try again next week.
Yeah. And I think that's a big part of it, right? Like letting it go. Like that was that session. I tell this to myself and to my interns all the time, like that was a session. You had that session. And if it didn't go the way you wanted it to, or if you didn't facilitate it the way that you would on your optimal moment or day, like that's a session. It doesn't represent who you are as a therapist or what you're capable of. And it might not have had nothing to do with you. Like maybe that kid had some other things going on that day that like you had no control over.
Like telling your interns, like you get to go up to bat an unlimitless amount of times.
Yes. The kids will stay here.
Yeah.
There will be more friends.
You don't ever get to strike out. Sometimes you hit a home run. Yeah,
exactly. And I think that's for me too, is like when it feels so good. It's like when you've had a hard session with somebody and you come back another day and it's just like the puzzle pieces fit together or something. And it's
like,
just,
where was this child 2 days ago? Who are you?
Yes. Oh, that's awesome. What do you think is a common misconception about medical music therapy? So it could be outside of the field or inside of the field.
Okay, so I think it's like a little bit of both, because people may think they have an understanding. I don't know. I don't know if anyone else out there gets the like, oh gosh, that's so weird. I didn't know I did myself. Hold on a second.
You're fine.
Like the tap on the shoulder and the big eyes and I just don't know how you do it. How you just go in there every day and work with those sick babies. And they think that, I assume they think that the majority of my day is a sad one, which is really funny because the majority of my day is literally singing and dancing and playing and creating and it's at the same time happening while these kiddos get stronger and smarter and healthier. So it's really a joyful experience. We're the happiest part of their day most of the time, not all the time. Okay, can't take the credit all the time.
Yeah.
But most of the time, we are what they wait for because they choose us, unlike a lot of things that happen to them in the hospital. And we'll say, my ratio is 90-10. I think about 10% of my job is the saddest sad you could ever sad, but it's also the biggest honor that you are ever given. I think that I will ever be given in this world is to be present and to be still providing when the rest of the hospital cannot. I think it's really cool. I think our job is so great. So I hope I haven't changed too many minds out there. You guys keep doing your other things, leave the music therapist stuff to us because I need a job.
Yes. I think that's a good point for students who are interested in this stuff too. You know, it's not always super sad, but it's not always like you see it in the commercials. And being cool.
Oh gosh, yes, exactly. But like slow-mo, like black and white.
Exactly. It's a nice healthy medium and kind of playing off of that. What types of music therapy interactions do you feel most passionate about on that spectrum?
Yeah. Okay. So I kind of took liberty with what you may have meant with interactions when thinking about
as much liberty as you want.
Okay. I have two answers because I have a head answer and a heart answer.
Love it.
So my head answer is like, oh, interactions. What kind of music therapy do I most enjoy doing? And that is typically like rehabilitative or developmental music therapy. I was a specialty care music therapist at Riley Hospital for Children. And so I worked with chronic diagnoses. So hematology, oncology, CF, transplant or, organ transplant. And when I moved to Texas Children's, I served almost none of those areas or units of the hospital. Instead, I focused on neurology and rehabilitation and acute needs. So seeing kiddos utilize music, be motivated by it, and like rapidly increase, like enhancing, improving, and then going home a better version of before when like they got to the hospital. That has been, I really enjoy those interactions, the music, the techniques and interventions that I've learned and getting to apply those and like look like a wizard when really I'm just a trained music therapist who knows what they're doing. It's always cool. But my heart answer, it's kind of cheesy, but like my favorite music therapy interactions are the unabashed ones. Mm-hmm. This is the like 7-year-old who is just like singing at the top of their lungs. They don't care who hears. Their whole soul is just like pouring out of the words, or like dancing with ribbons when there's like a fearlessness and an ability for them to forget a lot of what weighs them down. It's, when the teenager comes to you and is like, okay, I finished the verse to the song that we were working on, but it does have the word in it. But it's just exactly like how I was feeling about it. And I can then tell them, okay, I'm here for it. If that's 100% how you want to express, I support that.
For sure.
And like letting them be unabashed in their, like when there is such trust and the walls are so far down that like a mom is 100% comfortable just crying, tears of sorrow, tears of joy. They trust you and they feel safe in the music that you provide to do that. Those are my favorite kinds of music therapy interactions.
Yes.
Unabashed, just like, I guess, authentic, to circle back ones.
Exactly. And if we want our patients to be authentic, we have to be authentic. I love that. I also love that you said the stuff about curse words in music, because I think that there are appropriate times. Like
Yeah.
if you're a teen and you want to say a word that's not
Right.
for your kids
Exactly.
and
And the fact that you're like asking,
aggressive. Yeah.
no, you're already like, oof, like this may be something that they turn down, but it's okay. And if it's something we can support, and of course, I'll say like, yes, absolutely keep that in your song. We are going to have to record that portion of your song at like a time or in a place where
Right.
little ears are not going to hear it, but fine.
Yeah. It's getting to yes, as I like to say.
Right.
I love that. So tell me about a patient or a patient interaction. And I know it's super hard to pick like one or two that has changed your practice.
Yeah, this
It's
is
like asking like, what's your favorite song? I know.
that's so fair. I'm grateful for every patient interaction I've had. There are a few that have changed me, like not only my practice, but me as a person.
Mm-hmm.
But I think about one because it was early in my career and I incredibly intimidating. So I was at Riley and we had she was like 14 months, came in, incredibly rare diagnoses of a form of cancer that metastasized solely in cerebral spinal fluid. And was essentially slowly shutting down her brain's function and her ability to utilize they thought she had Bell's palsy because there was a weakness that was happening for half of her body. And what was intimidating was that not one, but both of her parents were music educators. So her dad was a choir or band instructor, but also conducted the church choir. And her mom was like concert level pianist and was teaching middle school music. And so I remember thinking, what am I going to be able to do that they're not going to be able to do? I can't play a sonata. They're like, I don't have just incredibly gifted individuals alongside of both of them having multiple degrees between the two of them in music. Mm-hmm. And then having the experience of being able to show them how music was going to be able to shape, I call her Sunshine Charlotte. So how music was going to be able to shape Charlotte's quality of life, how it was going to keep her half smiling and reaching for instruments and froggies for as long as she possibly could because music was so motivating. It was helping provide them with tools to process and grieve and mourn their child, and getting to then see how music therapy shaped the way they then informed their students as music educators after Charlotte passed away. So I just remember being terrified and thinking like, I certainly don't have anything to bring to this table, and being completely wrong and letting them teach me and inform me and my practice that my education and the way that I have learned to utilize music is unique. It's specialized and it's incredibly important.
Yeah. So. That's great. And I think I was thinking about this today, and I was working with a patient who one of her parents is like a famous musician, and I felt so incompetent. I was like, I shouldn't be playing right now. This is dumb. Like, what am I doing? And you're right. Like, we have a skill set that isn't taught just in music. It encompasses, like you said, this authenticity, this human aspect. And we can kind of show them too and model, like, you have some of these skills and this is a way that you could connect with your child. And also we can do some of this and take it off of like your burden for a while. I love that. So many things to learn from so many patients. I love it. So here's one that I don't even know what I would answer with this. So I appreciate you tackling it. But if you had an extra 4 hours in your day, what do you think you would do with it? Or what would you accomplish?
Love this question. Two caveats. This 4 hours has to be uninterrupted, and it has to be like time warp, where like the sun doesn't set, it doesn't go away, and like time kind of freezes, and I just have 4 hours.
Yes, I totally agree.
I would be fluent in Spanish. I'd be working on French. I would play the piano like Mozart. Coming at you, bro. And I would have like muscles like rocks.
Yes.
I don't know. I think like I would utilize those 4 hours to, and like maybe every once in a while sneak in like an episode of something I would want to see. Who knows? But like enhance my communication skills, my musicianship, and take care of my body, because as I get older, I learn that it gets harder and harder to do.
Oh, at 25, I swear it's 25. I threw my back out.
Watch out, all y'all. 20s, you're like coasting along, singing a song, and then you're like, ow, oh, what happened?
I was on the ground with a patient. Yes, I heard a pop, and then I was like, excuse me, Mom, you have to leave. I can't get off the ground.
Yeah. Someone go get help.
I think somebody wheeled me in an office chair down to my car, and I like drove myself to urgent care. Yeah. But yeah, I mean, I love that you took that question this way, right? Like, I think my ridiculous like work brain is like, I would try to see like more patients. I would try to work, but like you bring up such a great point that self-care is so important, and like that should be something, especially in a medical setting where you're running around. Like my watch gets crazy steps each day.
Yeah.
You should try to do some things for yourself, and taking breaks during work or doing things that like help your body.
Yeah. I'm still learning about the breaks during work thing. If we had a time warp where there was like nothing else happened in the hospital while you sit on your booty, that'd be great. But I haven't figured it out yet.
It's a pressure. It's a pressure that like there is no, I don't know how it works with you guys, but like no one tells me you have to see this amount of patients. It's an internal responsibility and pressure that I put on myself to like try to accomplish as much as I can.
Oh yeah.
Yes. And this isn't a question, but do you have any thoughts on prioritization or things like helpful tips that have helped you when you're prioritizing your day? I know you have like so many beds, so many.
Yes. Even with COVID numbers, we're sitting at, I literally counted today because I'm preparing a presentation for one of our units, but over 500 filled beds. We have 900 like accessible beds, 937 to be exact. And so I was counting and I was like, what? That's amazing. Like 3 of our units aren't even open right now. What's happening? So we have a lot of beds, and how we then personally Texas Children's kind of prioritizes is we have a triage tool. So we enter in different components for each kiddo that we get consulted or referred to. We call it code black. If that's an imminent death or end of life situation, they automatically skyrocket. We then try and take care of any acute pain crises or procedural support, because those are happening now or are happening, in the moment.
In the moment.
Not something you can address later. Exactly. We then go to rehabilitative and co-treatment, because oftentimes that takes collaboration with other professionals in the hospital. And then any psychosocial, developmental, emotional, those kind of trickle that way.
Mm-hmm. Yeah, I love that. I love that you guys use a tool. It takes some of the, I know sometimes it feels like if you connect with a patient or something that like that should determine your prioritization. And really that's a boundary, right? Like we should
That's
have
fair.
tools that show us why we should be seeing patients the way we
Yes.
do. Yes. So what does advocacy look like to you?
Ah, I love this. I love this question. Advocacy to me is translation. It is the ability to tell a 4-year-old and her mom what music therapy is and what we're going to do together during our time, and then walk out into the hallway and explain the science and efficacy to her neurosurgeon about music therapy. And then, I don't know, get in your car and drive to the Capitol and talk to your legislation about why they need to pass a study bill or protect music therapy via licensure. It is, advocacy is the ability to tailor the language while keeping the integrity of the message.
Mm-hmm. I love that. Another quote on my whiteboard. I have a big whiteboard at work.
Advocate.
That's amazing. So, I don't know if you feel like this, but sometimes I feel burnout. I just went through a season of feeling really burnout in COVID. And what inspires you to continue to do this work and to be in peds and the medical setting?
So, there's a quote, thanks Matthew McConaughey, and it says, he's talking and he's like, yeah, I get older, but they stay the same. And he's not talking about kids, but I kind of am. It's that there are always, it's always going to be, I was just like, just today, this kiddo's first time seeing a guitar played, first time getting to touch and play the guitar. It's the children, if you want like a short answer, succinct. The kids are what keep me coming. They're what continually motivates and inspires me.
Yeah.
What helps fill me up, or actually, who helps me realize I need filled up, are my coworkers, like the colleagues alongside of me and within our field. The work group is definitely like a safe space for me.
Yeah.
I think it's also really important to have an identity outside of music therapy,
Yes.
which I know it doesn't sound like I do, but I promise I do.
We do.
I have friends that, know me as Yogi Mayor, we met doing yoga, or I have friends that we like to have tea parties together.
I love that, by the way.
Yeah, it's being a music therapist always, but like, sometimes being a friend first, or being a friend first always, maybe too, though. But having qualities, characteristics about yourself that make you multifaceted. How boring would we be?
Yes, it's so true. And that I think is a self-care thing, right? Too. Like you can't be music therapist Marial all the time.
Yeah.
Like, I know you're married, you have friends, like you have other things going on.
Yeah. Getting to
would be very excited. Huh?
Right?
Yeah.
I was like getting to immerse yourself in like others, but not in a work way, like
Yes.
watching. Daniel loves scary movies, and it's October, so we don't watch scary movies until October because I hate them.
Really?
Yes. What? Yes. Why don't we watch a scary movie in February? So we're watching, we'll watch scary movies that he finds on Netflix that are typically terrible.
Yeah.
But it's something that we do. He's coming outside.
That's so fun.
Yeah.
We also have movie club every Sunday. It's basically my husband's way of being like, get off your phone. We're just watching a movie. We'll put popcorn out, but you can't have your phone.
You'll put your phone down if you have to pick the popcorn up. Go.
Yeah. Awesome. Well, what do you hope for the future of medical music therapy? I know you and I always think about this.
That's so true. In my ideal world, the future of music therapy is very bright. Medical music therapy at every hospital in the world. Every hospital in the world has at least one music therapist, but most hospitals across the world are adhering to the standard guideline of a ratio of at least 1 to 100 music therapists to patients, so that there are not just programs of one, which can be incredibly challenging, but we have ability to lean on one another. I want medical music therapy. I want music therapy to be so commonplace that we are like the cool cousin to like social work or physical therapy. Like they know it. One of these days I'll get in an elevator, and instead of someone being like, "Oh, you got a guitar on, that's so weird, what do you do here?" And you'd be like, "Oh, music therapy, so glad to see you guys. We're really hoping that you guys would stop by our room. We just have a few coping consults." And like, that would be awesome.
Yes, we'll get there. I love that. This has been life-giving to me this evening. Thank you for answering these questions and spending time with us. I do have a question here, and if people have questions, they're welcome to type them in the comments and learn from Mariel's wonderful brain. Anna says, I'm a junior at UMKC, majoring in music therapy and psychology, wanting to be with kids and adults for mental health. Do you have any advice on mental health?
So the mental health that I have been exposed to has mostly been adolescent medicine. So these are individuals under the age of 18. But it sounds like you have a really cool concept and an idea maybe of meshing or merging the two together. It might be pioneer work that you're talking about. A lot of weed whacking. It's going to be volunteering and committing your time to areas up by UKMC, right?
Mm-hmm.
So up in Kansas City, that serve those populations to make sure that you are really committed, but also to help you establish connections within both of those fields so that you know whom you can go to. Because it's not just what you know coming out of school, it's who you know and who's going to be helpful, who's going to help guide you into a career that you're really wanting to pursue.
Yeah. I have two great questions that just came in. So Caroline says, hi, Mariel and Amy. Thank you so much for speaking with us tonight. I'm a master's equivalency student at Texas Women's University. I eventually went to work at a children's hospital. I was wondering what advice you would give to stand out as an intern applicant.
Oh, love that.
Yeah.
So it is time. It is a commitment to your application. All of our applications look different and have different requirements, recommendations for your submissions. We can tell who, because like in ours, it says we want size 12, like Times New Roman font, double spaced. And if you are willing to put in that level of concentration and dedication to your application, then most likely you're going to mirror that within your internship. So being willing to take the time and to thoroughly review and answer all things on the application. I love candidates that reach out and like via email, keeping me informed and letting me know this has been submitted, but that's not every internship director. So I think you can touch base with places that you're wanting to apply or pursue and say, hi, I'm interested. I have already found your information on the website, because
I think that's the important part, right? Like if it's up there, I don't like questions that are like, where do I find the information? Because that doesn't say like follow through to me.
Right. Agreed. Yeah, it's like, oh, it's already out there. You haven't researched our program. You haven't even gone online to see what music therapy looks like at St. Jude's or at Texas Children's. Yeah. So I don't want to write. I truthfully don't want to write back to you, but I obligatorily will.
Yeah. Yes, exactly. I mean, I think, people, if they're going to ask of your time, we want to ask of their time too. And we want them to have that commitment. I think you totally hit the nail on the head as far as being mindful when you're filling out that application, if there are those specific things. For me, a big one too on that topic is like, are things spelled correctly? Or is there proper punctuation?
Like my name.
Yeah. Oh, yeah. It's little things.
Yeah.
And I think too, I'll say, if you're applying for an internship and you get an interview of any kind, thank you letters, like thank you emails, just saying I
Following up
appreciated your
afterwards.
time and following up after it really stands out to me that you like have that courtesy that we would want. Somebody like I always do that in job applications. So I think that's a big one.
Yeah, gratitude is a sign of a well-rounded person.
Yeah.
Gratitude,
Absolutely.
you cannot teach gratitude this late in life.
Yes. So true. And we do this, we don't get paid to do internships. So I think knowing that and that we do this because we believe in students and we want to further medical music therapy. I think it kind of goes with that gratitude piece, right? So being mindful of our time and saying thank you after we have an interview.
Yeah.
Our other question is a intern from Children's National. She said earlier, I think this is a great question, so thank you, Eva. She said earlier you mentioned the importance of authenticity. How do you balance that with setting boundaries within the therapeutic relationship?
I think you're honest with them. If they ask you something and it crosses a boundary therapeutically for you or for them, you say, I have always been trained to say friend because it is gender neutral. It's not ageist. It's right. So I would, gonna like literally role play. So friend, that is such a cool question. And I wish that I could answer it. But just like I'm very careful with your information when I leave our time together, I'm very careful with my own information too. It helps protect me.
Mm-hmm.
And if they're older, it's saying, yeah, like I think I know exactly what you're talking about, Eva, but like if they're asking questions of you as in disclosure, clarify if you need to. But I think it's again saying, boo, I would love to give you my cell phone number, but you know that's not allowed. Can you imagine like how many people would be trying to hit me up late at night when I'm trying to help grandma?
Yes, like leaving work at work. If you're able to message you.
Right. And so I just tell them, and I probably literally would tell them like that, where it's like, I am not going to give you my number. You can ask 1,000 times. Bye.
Yeah. And I think like knowing what's okay to share, like, are you sharing something about yourself because it's going to enhance the therapeutic relationship, or are you saying it for yourself? I think that's another huge part of that. Like, and I think obviously, I think part of it, I think I was talking about this the other day with parents. A lot of times at my setting, I work with chronic kids. Parents might ask you, how was your weekend? And I think they're asking that because they want some normalcy in their life and they want to hear about something outside of cancer. So I might say, oh, it was great. I went outside and I walked my dog a lot. I think that's totally fine and appropriate.
Right, it's true. It's something that you did, but it's not like everything you did.
Yes. Yeah. So like filtering those things, I wouldn't tell them like I had a big fight with my husband or, like something that was just not appropriate to share. And I think there's a gut feeling that comes with those things too.
I think it's nuances that you learn as well. Going with your gut and your training never hurts.
Mm-hmm. Or asking somebody else, I was thinking about like using this to enhance my relationship and build rapport. Does this feel weird to you?
Yeah, agreed.
Yeah. This has been lovely. I love using my platform as an excuse to hang out with cool people. So, Marial, thank you so much for having us. Yes, and this whole thing, we're hoping to do it like once a month, medical rounds with music therapists. Any medical MTs might be on here answering these same questions, and hopefully just giving you an opportunity to engage with medical music therapists around the country. So Marial, thanks for being my guinea pig. Everyone is saying thank you, and we will see you for the next one. So bye, everybody.
Bye.